Hello, we're here this morning to talk about a fascinating subject, breast lumps in young women. And we have Janine as our guest, who has been there, done that, and her story makes so many important points. This is the kind of points that can save a young woman's life. So Janine, tell me, how old were you when you found your lump?
I think I was 28.
Mm-hmm.
That's a long time ago now. I was 28. I was in law school. I was working part-time. I was planning a wedding, and I think I was in the shower and I found the lump, and I didn't pay a lot of attention to it at first, but it wasn't going away. So I got a referral to an OBGYN in Beverly Hills. I thought, okay, I can't do better than that.
Top of the line, Beverly Hills, huh?
Yeah, so probably went there maybe 2 to 3 months later, maybe a little longer.
You're not one to rush, are you? No. Well, you had so much on your plate, I can understand it.
Yeah, no, it was a very busy time. But I went to see him, and I think there was probably some delay in getting into him too. And he told me, what am I worried about? I'm young, I'm healthy, I'm fit, it's fibrocystic, it's nothing. Go home, don't worry about it. So I went home and I decided not to worry about it, but it wasn't going away. And so I called a very good friend of mine whose father was a radiologist, who is also a friend of yours. He referred me to you. I came in to see, I believe, around April, and I think, you said we're going back 20 plus years almost. You did an exam, and you also said, well, let's see where it is in 6 weeks, let the female hormones adjust.
Right. Yeah.
Came back in 6 weeks, and you did the ultrasound, the needle biopsy right there and then, and you said, okay, you called me a few days later, I think after the results came back, and said, okay, it came back negative. And I can't remember, I think we may have done it face-to-face. Said, okay, but you should take it out. That's the only way to be 100%. Right. So I said, what are the odds that it's not? And it was 90-something%. It was pretty high that it's nothing.
Yeah, I think I probably would have said something like 90, less than 1 out of 100, because this had the classic appearance of a fibroadenoma. On the ultrasound, it looked round, it looked non-suspicious, it was movable, it had the characteristics of a benign tumor. And so I thought when the fine needle came back showing benign cells, the overwhelming odds that's what's going to be. We could wait, but there was something about the report that just made me a little nervous, or something about, I know there was something that made me say, I want to see you and get this thing out. And then, of course, you had a few other things on your plate.
I had, I think, finals a week later in law school, finishing up law school. And then I was starting my clerkship for the summer, planning a wedding for that August. And the other big part for me at the time was health insurance. Yeah. I was going to get on my husband's health insurance that August, which was a whole lot better than what I had. Right. So I said, can it wait? Yeah. And you're like, well, okay, 5 months, but let's leave it at I think it was about 4 or 5 months.
So in the interim, you had your wedding, you still had a lump. So on basically the happiest day of your life, you were harboring basically a silent breast cancer. What do you think, looking back at that, is that?
It is very difficult to look at, because at the time of the wedding, I was free and there was nothing to concern me. But when I look back, I'm angry. I'm angry at the ignorance of the doctor I saw, a well-known OBGYN, and me with no family history, really not knowing anybody in this community. I was going to let go and rely on that. Had I had listened to my doctor, and had, for example, I only been able to get a mammogram at 50, I'd be dead today. So,
with these new guidelines telling women to start at 50, I mean, it might assist you in the gut to know that this is a disease of young women. The ramifications are delayed diagnosis, increased mortality. I mean,
it's truly frightening to me. And my story, I've shared a lot over the last 20 years, and it's caused a lot of people I know to get mammograms earlier than they would, of which some caught some early breast cancer. Of which some were able to have it removed and not have chemotherapy. So what a life-saving part to that. But it's angering. It's angering to look that I had cancer growing in me, and at the time, very angering, because had it been caught earlier, I may not have had the positive lymph nodes. I may not have had to have such aggressive chemo. A lot of factors that have impacted me in my life.
And that's precisely the message that we're trying to get, is that women have to be prepared to know more than their doctor. Here you went to a top notch doctor, but the doctors are getting so busy now. There's so much paperwork. They can barely get time to look at the patients. They're stuck on the computer typing things out. And so the woman has to go in and be proactive. If she thinks there's a lump, she has no family history, she's young, she needs to know that, wait a minute, we can do an ultrasound. It's simple, it's inexpensive, and that's going to screen out most of them. You can do a mammogram now. We have better technology to detect these things. But the bottom line, if you're not sure, this is the point I think your story makes, is that you just can't take any chances. If there's any question, it's just better to take it out. Now, one point, in those days, we didn't have the fancy needle technology to take a core sample. So that's kind of ancient history that we had to go in surgically to make a diagnosis, but that was our only choice at that time. Had you been seen a decade or sooner or later, that we just would have been an outpatient needle core biopsy. We could have made it and then planned out your surgery.
It all worked. I mean, I'm so grateful for you and the way it worked, but it's scary, and it's one of the things I always tell people: trust your instinct. Don't trust your doctor. If your instinct tells you something different, push and get the opinion. If I hadn't gone to you, I wouldn't be sitting here today with the incredible life I've had.
And you have had an incredible life. I mean, it's been amazing what you've been through. But just to review what happened, we went in and we found a couple of nodes that were positive.
Yes.
You ended up having both breasts removed, reconstructed through chemotherapy. But how many years ago? You're how many years survivor from breast cancer now?
20.
20-year survivor. So at 10 years, you're statistically a cure. So you're way, way beyond that. But it's so nice to have that feeling that you were able to put that behind you, even though you went through a heck of a lot. And it's possible that if you had first felt this and the doctor had worked things up at that time, that was almost a year delay, wasn't there?
Yes, but from the time I saw him to diagnosis was a year.
Yeah.
And that could have been the lymph nodes.
Right. So the tumor itself was kind of slow growing. It wasn't that big when we took it out, but this is another lesson. What looks like a early favorable situation can have problems. You ended up being a stage 2B breast cancer and requiring that aggressive treatment, partly because of your young age you had it, but it works. Here you are, somebody's gone through chemo, gone through reconstruction. And I think this is a story that makes so important to every woman, that despite your age, young or old, if you detect a lump, if you're concerned about a lump, it's really easy to work it up. It's easy to figure it out, but you have to go to a doctor that will listen to you, do a careful exam, do the proper workup, get the ultrasound, the diagnostic imaging, get the needle core biopsy. And if the doctor's not willing to take an aggressive approach, it's up to you to find a doctor who will. There's a lot of good surgeons out there who are capable of doing this, but many doctors, oftentimes the primary care doctor that you're most familiar with is simply not, they're in such a rush and they think you're too young or the exam isn't impressive to them and they just don't take it seriously. So I think your point, the way you said it, is right. That just, how was it in your words?
Trust your instincts.
Trust your instincts.
And get the answer. And your words to me 20 years ago, I've repeated I don't even know how many times. You never know unless your doctor looks at you and says, I'm 100% sure.
Yeah, is that right? It's amazing. That's a good point. I think the other thing is this issue on self-exam. It's possible on doing self-exam to pick up really small cancer. So yours was really quite tiny, and yet that subtle change, had you not picked it up, then things would have been even further delayed. So you get kudos for doing the exam, being familiar with your body, recognizing it's a change. It's not pleasant to have to track down a doctor and go through that experience of a consultation. And then there's always this doubt when they don't do the right thing. So there is reason to be upset about your history because some things just didn't fall into place. No. Thank goodness, at least we got to it. We took the nodes out. You went through your chemo, and now you're a cure. So that's a fantastic ending to a really important story and sometimes a disturbing story, but there's incredible lessons, life-saving lessons in this story. We'd like everybody to think this out. This is the kind of story that could save your life.